Hello, my name is Cheryl Richardson of Aspen University. I will be giving a brief presentation on healthcare management guidance. The purpose and objective of this presentation is to briefly discuss important regulatory, accreditation, and organizational compliance policies for healthcare based in a hospital setting. I will also be discussing a few of the 2020 National Patient Safety Goals and how quality care can help guide healthcare costs. References will be shown at the end of the presentation. Regulatory guidance. In 2016, the Department of Health and Human Services focused on improving patient outcomes and decreasing medical costs with implementation of 8 legislation acts, which have had a significant impact on health issues and concerns for all American citizens. The Healthcare Quality Improvement Act of 1986 was enacted to provide immunity for medical professionals during conduct assessments and protection from peer review related lawsuits. Medicare is a federal health insurance coverage program for over 50 million American senior citizens who are 65 years and older, younger people with disabilities, or someone with end-stage renal disease. Medicaid is health coverage that is provided jointly by the state and federal government to over 63.8 million low-income adults, children, pregnant women, elderly adults, and people with disability. Each state manages their own program differently. The Children's Health Insurance Program, CHIP, matches federal funds to state funds to provide health insurance for children of families who cannot afford private health care coverage or their income is too high to get Medicaid. In 2012, the Hospital Readmission Reduction Program was created under the Affordable Care Act for Medicare and Medicaid services to pay a reduced cost to facilities for excessive patient readmissions within 30-day period for specific conditions, poor health, and multiple illnesses. The Health Insurance Portability and Accountability Act of 1996, known as HIPAA, is a federal law of national standards established to protect sensitive patient health information from unauthorized access and without consent. The Patient Safety and Quality Improvement Act was established in 2005 to protect healthcare workers. It is a voluntary reporting system to access data and resolve patient safety and healthcare quality issues. Affordable Care Act was established to provide states the option to create a health benefits cover program for low-income people who would be eligible to purchase affordable coverage through the health insurance marketplace. Accreditation. The Joint Commission on Accreditation of Healthcare Organizations, known as JCAHO, is a nonprofit organization that certifies and accredits more than 22,000 healthcare organizations. The purpose of JCAHO is to review, continually improve, and enhance the quality and safety of healthcare delivery in the United States. The National Committee for Quality Assurance is a private, non-commissioned organization that assesses and reports the quality of managed care plans. The purpose is to provide consumers with managed care information to distinguish plans based on quality and value rather than price and provider network only. The American Medical Accreditation Program, AMAP, is a voluntary comprehensive accreditation program used to evaluate the quality of physicians against national standards. The AMAP provides credential verification, office reviews, clinical performance, and peer reviews. The purpose is to maintain high-quality physicians. The American Accreditation Healthcare Commission Utilization Review Accreditation Commission is a 501c3 nonprofit organization that promotes quality care with managed care standards, education, and communication. The Accreditation Association for Ambulatory Health Care is a private, non-profit organization incorporated in 1979 to assist with improvement of quality care for ambulatory healthcare organizations. This organization provides education, performance measures, and establishment of standards. Healthcare compliance management policies. The HIPAA privacy rule establishes and protects how personal health information and medical records can be used and disclosed. It specifies the rights patients have over their information and requires all entities to protect that information. The HIPAA security rules is a subset of the privacy rule and mandates technical, physical, and administrative safeguards for electronic PHI. The False Claims Act, also known as the Lincoln Law, is a federal law that penalizes persons and companies who defraud government programs. The Emergency Medical Treatment and Active Labor Law, also referred to as the Anti-Dumping Law, was enacted by Congress in 1986. This federal law requires hospitals to treat anyone that comes to the emergency room for care. The Clinical Laboratory Improvement Amendment regulates and ensures quality laboratory testing and diagnostic testing of human samples. The results help healthcare providers identify and monitor medical conditions and diseases to make clinical decisions for patient care. The anti-kickback statute is a criminal law that prohibits payment compensation as a reward for patient referrals or business generated from a service payable by a federal health care program. The Stark Law prohibits physicians from referring patients for healthcare services paid by Medicare to any entity to which they have a financial relationship. The Occupational Safety and Health Administration, OSHA, standards was established by Congress to provide a safe work environment for men and women. Corporate integrity agreements are negotiated by the Office of the Inspector General with healthcare providers as part of the settlement of federal healthcare program investigation. Certificate of compliance agreements are also negotiated by the OIG with healthcare providers instead of a corporate integrity agreement. The organization must establish a compliance program that resembles the OIG compliance guidance document. Patient safety is a priority for every healthcare management level. Everyone is responsible for safety. The Joint Commission has identified the 2020 National Patient Safety Goals. A few are listed on the next two slides. Goal 1 is to improve the accuracy of patient identification by use of two identifiers when giving medications, drawing blood or collecting specimens, and when providing treatments or procedures. Goal 2 is to improve communication between medical staff and caregivers to report critical test results and results of diagnostic procedures. Goal 3 is to improve safety in administering medications to decrease errors between removal of medication from containers and giving to patients without interruptions. Goal 4 is to reduce patient harm with use of clinical alarm system to alert caregivers of patient problems. Goal 5 is to reduce hospital-acquired infections with compliance of the Centers for Disease Control and Prevention hand hygiene guidelines. Goal 6 is to identify safety risks with patient population hospitalized at a psychiatric medical facility.